Hi guys, I'm Kirsten and we did case study number 2. So case study number 2 reads, Tommy Bennett, a 40-year-old man, is brought to the emergency room by police officers because they suspect he has frostbite in his toes bilaterally. He lives underneath a bridge in a cardboard box in an area with many other homeless individuals. Bennett is 5 foot 10 inches and weighs 145 pounds. He reports feeling fatigued, losing 20 pounds within the last month despite continuing the same nutrition regimen, losing his appetite, and the presence of chills and night sweats. When Tommy is discharged, he will have a central PICC line that will need to remain intact for 2 weeks so that his antibiotics can be administered. His providers are worried about how Tommy will receive treatment despite being homeless. So the first thing that we'll discuss is the highlights of the medical issues. So the first thing that was discussed was the frostbite affecting his toes bilaterally. So that's a big medical issue that needs to be addressed. The loss of 20 pounds also needs to be addressed because that's a big thing, especially within only a month time frame. There's a lot of contributing factors that could be to that due to infection, as talked about with the antibiotic treatment, or it could be due to lack of food resources because of his financial standpoint. So, as indicated in this case study again, the antibiotics need to be administered about 2 weeks through the central line. Other than that, he also reports loss of appetite, chills, night sweats, and again, the weight loss. So those are the main medical issues. Next are the highlights of the economic implications. So as indicated in the case study, it talks about his being homeless. So that could be also a cause in the weight loss because he doesn't have a proper nutrition, proper diet, doesn't have a proper home, and there's just no lack of funds for resources or food. So after discharge, he will be discharged with a PICC line that needs to be administered for 2 weeks. That is a big economic implication that needs to be addressed as well in places where he can actually go and get the help that he needs. So as a nurse, it's your job to find a social worker and find anybody that can help him out in the funds to support him in getting better health. So those are just the major economic implications for that one. And next one.
I'm going to be talking about the implications of the status on patient care. So a couple of things that you're going to want to take into consideration are insurance, mental status, cleanliness, family involvement, and the living situation. So for insurance, that's obviously going to reflect on the care that he's going to receive since certain procedures cost more money than others. Not to judge Tommy, but a lot of homeless people have mental health issues. So you want to take that into consideration because that would also alter how you would treat him as a patient based on his needs. Cleanliness, that affects the patient care because he's probably going to be dirty when he comes in. So one of your priorities as the nurse is going to be to give him a bath and fresh clothes and things like that. Family involvement is a huge thing in recovery or anything to do with medical issues. So you're going to want to take that into consideration, see if he has anybody to support him for that. And his living situation, if he's homeless, isn't very clean. So that's also going to affect the patient care since that's pretty unsanitary.
Okay, so I'm going to talk about how he can keep his PICC line clean and what the nurse should tell him about that. So most importantly, he needs to keep it as clean as possible and dry. He should avoid swimming, contact sports, strenuous activities that would just might affect the PICC line being in, and then washing his hands. The nurse might give him a bar of soap once he's discharged to help him out with that. He should never reuse any of the supplies for his PICC line. He needs to be taught how to flush the PICC line with saline or heparin, and then properly disposing of the dirty supplies is also important so he doesn't reuse them. And he needs to be mindful to stay away from alcohol and pets. And then, so complementary drug therapy, there isn't really any drugs that he can take as a complement to his antibiotics. It's really the antibiotics just to treat the infection, but he should be mindful of what drugs might interact with it, which can differ depending on which antibiotic he was given from the physician. And he needs to be mindful that he needs to follow the physician's order and the exact instructions, just to make sure that he's adhering to the correct procedures for his PICC line and taking the full dose and doing it for the full duration, just to get the maximum benefits from the antibiotics. And then just to stay healthy overall, he should be getting a quality amount of sleep and regularly exercising or staying active when he can. And seeing that he is homeless, I know he has limited options for this, but he needs to be mindful of having a healthy diet and doing the best he can for that. Also, trying to reduce his stress or practicing relaxation techniques so he doesn't become stressed, and then sustaining healthy relationships with those he interacts with.
Okay, so now we're going to talk about our plan of action for Tommy. I'm Morgan. Okay, and we're going to aid Tommy in finding a group home or a homeless shelter that he may be able to stay in. He needs to have somewhere that he can go to get his antibiotics and somewhere that we can set him up to stay. We found something called a Healthcare for the Homeless program, which basically functions to help homeless people find either like temporary or long-term care homes that they can stay in, and nurses can have access to them, and they can have access to nurses in return. We need to provide Tommy with instructions on how to keep his PICC line clean, like Kenzie was explaining. We also need to tell him where to be and how to prepare for getting his antibiotic, and make sure that he understands the importance of these antibiotics, and also explain to him if there are any adverse effects of that drug, what he needs to be watching out for. We need to provide socks to him so that he doesn't get frostbite in the future, because that's something we definitely don't want to see happen to him twice. This is just more information on a Healthcare for the Homeless program. It does provide preventative treatment as well as like post-healthcare treatment, which would be what's happening in Tommy's case. Treats illness and even checkups for when patients are well. And then we've attached a link that could be used by Tommy's healthcare workers to find a program near his area. You like put in the zip code and find areas where he could go to receive his antibiotics.
Okay, hi, I'm Jordan. I'm going to be talking a little bit about how the Christian worldview applies to Tommy's situation. So one of the themes of the Christian worldview is that we want to love and care for one another. We said that God loves everyone, so he called us to love and care for others regardless of their faith and circumstances. So in John, we're called, John chapter 13, verse 34, we're called to love one another. And then again in Mark chapter 12, verse 31, we're called to love or treat your neighbor as yourself. So we want to apply that to Tommy's situation. And we would do that by making sure we don't show any judgment towards him or treat him any different than any of the other patients, regardless of the fact that he's homeless and seems kind of unclean. And then we want to show him a place, or we want to make sure that he has a place to live, he has clothing, he has food, and that we help him find a form of payment. Another theme of the Christian worldview is health and cleanliness. So we're to take care of our bodies because God gave them to us as vessels so that we can go out and live our life on earth. So in John chapter 13, verse 14 through 15, this is when Jesus is seen cleansing a man's feet. And it says, "If I then, your Lord and teacher, have washed your feet, you also ought to wash one another's feet. For I have given you an example that you should do just as I have." So to do this, we want to make sure that we help Tommy clean up his body. And then we also want to use our patient teaching techniques, as previously discussed a little bit in the plan of action. We want to make sure that he understands why nutrition is important for his body. We want to help him keep his PICC line clean. And then we want to explain the antibiotics and their purpose in helping Tommy heal his body. And then we want to share prevention techniques so that this doesn't occur again. And that concludes our presentation, and these are our references.